What?
Yeah.
We can have joy. It's radical and amazing. And so many people need that nudge or that have fun in your work. I don't know. I know I was missing that for a long time. And I thank all y'all for, hey, that's part of it too. It's amazing. It's so good. And just Bridget, like meeting, I can't tell how many people are like, wow, it's Bridget and Dave, the Bridget and Dave. Like it's neat to come to the conference and meet some of your mentors and heroes and have them be so approachable. Again, that's what feels so different.
Hello, welcome to the Integrated Care podcast from the Collaborative Family Healthcare Association. I am the production editor, Grace Pratt, and I am joined by several of our co-hosts this morning. It is a beautiful late October morning in Oklahoma, and it's October everywhere that you all are. I'm not sure how beautiful it is, or for our listeners when you're listening, but we are hot on the heels of the Integrated Care Conference. And so, as our tradition on the podcast, we're going to spend a little time reflecting on the podcast or on the conference and thinking about what is happening in our community, what's coming next. I was saying to the co-hosts that they're just going to stoke the flames of my FOMO because I wasn't able to travel this year and I wasn't able to go. And so, if you, like me, were not there and you want to live vicariously through our panel of co-hosts, that's what's in store for you today. And I think we'll also talk about what's coming next and where do we see things going or conversations happening that's really on the pulse of what's happening in integrated care. But before we do that, we're going to start the way we always do with some introductions. If you are watching on YouTube, you may notice I'm not at home. I'm in my office. But then paradoxically, I'm also not dressed for work. I'm dressed in home clothes. And I don't know how to explain it to you other than work, life, everything's jammed together because I'm leaving from here and going to the third grade field trip at the zoo. And my office is a little closer to the zoo than my house. So that's where we are. But it made me think for our icebreaker question. We don't get to take field trips very often anymore at this stage in our life, but I wonder if you could go on a field trip, not a fancy vacation, not somewhere far away, and listen, you got to load up your work friends and take them with you because that's how field trips work. Where would you go? Where would you design a little field trip? So going around the circle from who I can see here, first we have Bridget Beachy.
All right, so I'm Bridget. I'm a BHC director of PCBH in the state of Washington and FQHC. And as far as the field trip goes, this is a no-brainer on my end. We're going to find some type of reptile garden, reptile house of some sort. And yeah, we're going to check out the reptiles and the frogs and amphibians. Because most of the time they call it a reptile house, but there's amphibians. And sometimes there's been a couple I've gone to where they actually have meerkats. So gets a little, and some birds, and that's where we're going to be going. And I'm going to
I
be,
could see the bird connection more. Is there something about meerkats that makes them a nice pairing, or was it maybe someone's just special interest?
not sure, but they had them out with the tortoises. So I think that's something tortoise,
Biotic. Yeah, interesting. Do you have a favorite
tortoise, meerkat.
reptile house place that you've been?
So when, shockingly, when we were in Germany, we're walking around and we had like our little itinerary, and now I'm blanking on the name, but there's this spot where you can basically walk out between Germany and Austria, and they made like in the forest, they made like a little deck, and you can go and stand, and on one foot you're in Austria, and the other foot you're in Germany. And so that's like what we had on our thing to do, in addition to a little waterfall and different things. And we're walking on our way there, and we didn't have a tight timetable, and all we saw was reptilian house. And I was like, oh my God, a reptile house? So we're thinking it's going to be in the middle of nowhere. It is like the middle of nowhere. We have to go back into this like parking lot, and you're thinking it's going to be some dinky thing. So now I'm getting worried for the animals. Like, what do they have back here? And we go in, and it's like the most amazing reptile house I've ever seen. There's dozens and dozens of species, and they were so well taken care of. These reptiles were so happy. And that just made me so happy. So hopefully, I didn't read all about it because it was a spur of the moment. Hopefully, it's some type of conservation effort. Whatever it was, they did a fantastic job, and it smelled like a five-star hotel. You wouldn't know it was a reptile house.
Amazing. Love that. Thank you for sharing. Next, we have Monica Harrison.
Hello, everyone. Monica Harrison, licensed clinical social worker, integrated care, a lover of all things integrated care, clinical trainer, and implementation coach at the AIM Center. I was trying to think about field trips, and I tell you, uh, I don't really like reptiles and bugs and things. And so I'm like, I want to go for fun to hang out with y'all, but I don't want to do that. It's also cold here right now, believe it or not, here in North Carolina. It is 53 degrees right now. I am cold, so I had to grab my sweatshirt. So I'm thinking of an inside field trip. Where could we go inside? If you all were coming with me on a field trip, visiting me here in Greensboro, I would take you to the Civil Rights Museum because that would give you something different, a little bit of culture, a little bit of
Mm,
history of
mm,
the area at the same time. And I love
mm,
that. When I go somewhere, I like to see a little
mm-hmm,
bit of the history of that area. And so I would take you to the
mm,
Civil Rights Museum where the counter sit-ins happened here, and they have replicas of some of that. And videos, and you walk through old memorabilia. You can walk
mm-hmm.
through on your own, or you can get a little tour of it with a tour guide that talks you through it. I think that's what I would do. I would do the Greensboro Civil Rights Museum. So if you're ever this
Yeah,
way, in
yeah,
addition to calling me up so we
mm-hmm,
can like just go have fun, go do that. Go to the
yeah.
Civil Rights Museum so you get a little bit of cultural and history at the same time.
That's awesome. I would totally join you, Monica. I'm a history nerd. Like when I go somewhere, I want to take like a history tour and hear about all the stuff.
Yeah.
We went to one in Memphis with my kid, my older two kiddos. My husband teaches high school history, and it was amazing. The Memphis one was so cool. Yeah. Anyway, yes, Civil Rights
Yeah, it's
Museum,
the
so fun.
yeah, the history
Yeah,
stuff. I think it's
yeah,
I always feel like it's important, even
it
when
is.
I do the nice extravagant
Sure.
vacation, as Grace mentioned, and going out the country and things of that nature. I still like to just know about the history of the area. I think
Agree.
that's just important in a way to also enlighten yourself in a different way.
I
So,
didn't know that I was going to be crafting like a little travel bucket list for me of coming to visit you all and go to these places, but I think that's how it's going here.
I
Uh,
like it. Podcast on the road.
oh my gosh, wouldn't that be amazing? We could do a tour, live shows, sure, except mostly just spend time together. Next, we have Jen Thomas.
All right. Hey, y'all. Jen here in Illinois, Morris Hospital, co-director, medical director, CFHA. Okay, this got me thinking about memory lane of something I would redo that I got to do as a resident. So I was a first year intern. I trained in Hinsdale Hospital in Chicagoland, and our whole residency had to do a required field trip like that June week, like before like you hit the ground on July 1, taking call and whatever. So it was part of the take your PALS course, get certified in ACLS, and we have this field trip. And we're like, what is this? It was an amazing outdoor high ropes course. So as a team, we had to get in harnesses and climb up these telephone poles. I still remember my good friend Joan. She was like a mid-career, late career physician. She was probably in her 50s when she applied for med school. She'd worked in like Hollywood on like TV shows as a producer, like Dallas and whatnot. And she was so afraid of heights, but like it was really empowering for her. And we always still laugh about that memory of I could barely get up two rungs on that pole. And it is team building. Oh yeah, I remember Bob's pants split when he was like 30 feet in the air and stuff. Probably also, I don't know if anyone would join me on that adventure, but it was really cool and really fun. So if you need an
I
idea
would
to
do
torture your
that.
interns, you would do it? Okay, Monica, let's do
Yeah,
it.
I would do that. I would
All
be
right,
for that.
yay.
Okay, let's go.
Let's go climb.
Yeah, it's a
Bridget's
high
up for
level
it.
of trust too that you have to put into someone.
Yeah,
And I hope Bob got his pants sewed back up. But that's a
I
high
hope
level
so.
of
So
trust you put into somebody.
I don't
We
think he listens, but somewhere he's gonna be like, Jen, you told that story
Oh my
back.
gosh.
Oh, if he does,
We,
it's all good.
our residents do a retreat every year and they go do an activity. And one year they went to a ropes course and there was this like really big slide situation. And one of the residents went on the slide and broke his tailbone. So,
Shoot.
little injury on that
Uh-oh.
one. It was
Uh-oh.
fine. He was fine, but they
Whoops.
didn't go back to the ropes course for a few years after
Fair enough.
that.
Those things you can get away with in the 90s, early 2000s. Nowadays, it's
Right?
too risky.
Yes, yes.
Yeah.
Next, we had Deepu George.
All right. Good morning, everyone. My name is Deepu George, and I'm a behavioral health consultant at the University of Texas Rio Grande Valley, all things integrated care, PCBH, and at CFHA this year. My entire team was there. And so I think when you said you got to bring your work buddies with you on a field trip, like, where else do I want to go other than the Integrated Care Conference? A shameless plug for our own
I
conference.
like that plug.
This whole
I like
episode
that
is a
plug.
shameless
It
plug
is
for
a
our
Love that
shameless
conference. So
plug
you're
plug.
for our
fine.
own conference. But if you were to ask me specifically, I have local, national, and international locations that if you want to go on field trips. Locally, the closest place that I always want to go to is NASA. I think
Mm.
as when I saw Apollo 13 as a young kid, I always wanted to be an astronaut. And so NASA has like a couple of memories for me. EJI in Alabama, the Equal Justice Initiative with Brian Stevenson, that would be another place that I would want to go. And then if you're thinking international, to the Lord of the Rings set. And I don't know if everybody would want to do that, but that's where I want to go. And then Vatican and then England. So parts of England that has to do with Anglican history. There's my field trip list.
Ugh, it's a good list. Thank you, Deepu. We're missing our leader, Neftali Serrano, this morning. So who knows where he would go. But
Great roll of the R's, Grace.
I'm really trying. It doesn't always come out right, but Neftali said he likes it, so I'm always going to try. I am Grace Pratt. I am the behavioral medicine faculty at Integra's Great Plains Family Medicine Residency Program in Oklahoma City, Oklahoma. And I asked this question without knowing the answer, like I do a lot of the times. But as you guys spoke, and as Monica was talking about this particular history in your area, I was thinking that if you came to Oklahoma City, I do think I would take you to the Memorial Bombing Memorial. The Murrow Bombing Memorial, if I can say it. So in 1995, there was a devastating terrorist attack, domestic terrorism in downtown Oklahoma that really marked a lot of the culture and ways that we move through the world in Oklahoma and understand being an Oklahoman. And there's a beautifully done memorial, which I actually got to visit on a field trip when I was in my master's program. And I took a class on trauma and trauma treatment that absolutely has impacted the trajectory of my expertise and life as a therapist. But we went to the Murrow Center Memorial, and I grew up in East Texas. So I didn't grow up with this Oklahoma feeling of that attachment to it, but moving through this place and seeing the resilience and the thought that was put into the memorial and honoring these lives and recognizing the history and the impact on this place is really moving. So I would take you guys there. And I hope one day you do come visit me in Oklahoma. It is actually a pretty nice place to be. And we've got some really fun. I think even to the point that like the impact of the memorial and the bombing and that on our culture, you may know that earlier this week, our Thunder players were awarded with their championship rings because we're the NBA champions. And on the back of the ring, there is a symbol of the memorial and the reflecting pools that are there. And so just like honoring that history and heritage was really cool. Let's see. I think that is all that I want to say about that right now. Neftali, like I said, is not here, but if he has some news and notes for us, this is where we'll cut them in. Okay, you may or may not have heard from Neftali there. And if you didn't, you saw about how the sausage works of making the podcast. Anyway, we want to talk today about the conference. I've already said I wasn't able to be there, and I'm like deliberately
I
avoiding
feel like, is this the
things that are-
second year we've missed you?
No, I was there
No,
last
Oh,
year.
no,
we
we
were
saw
we
you
were
last
hanging.
year.
Yes, we
That's
were
right.
hanging last
Okay.
year
It
in
was
San
more
Antonio, Grace.
travelable for me, but just
Yes.
stage life right now. As much as
Yes.
I lived in North Carolina for a couple of years. I love North Carolina. As much as I wanted to be there, I just couldn't quite work out the travel this year.
Sure.
So fill me in, guys. What I missed? What were some of the highlights? Tell me how it went.
Mm,
It was a blast.
it was.
I was gonna say as always, but it was a blast. Like
Yeah,
it really was
it
a
was.
blast. I didn't even get to connect with everyone. I don't know why this year, every year I feel like it goes so fast. Like
Yes.
those few days, it's jam-packed, so many good sessions to go to. And I still feel like I didn't get an opportunity. I connected with a lot of folks, but then missed some of my normal folks too that I would connect with. And so it just wasn't enough time. I always say it's not enough time with my people.
Yeah. I think Beth Ziegler Schreider said it feels like a family reunion because like you show up and it's like all these people that you know and love and you want to make time for each of them to catch up and what's new with you. But it's hard because there's only so many minutes in the day to do that FaceTime with everybody. But I think I know that's what stands the conference out apart from medical conference. John Lauer is a psychiatrist in Illinois that was second time attendee. He came and he was talking about the conference. Like, it's different than medical. At medical, people are buttoned up. They're there to kind of like share evidence and talk about what they're doing in the world, and that's great. But he's like, when I came last year for the first time in San Antonio, they were up there on stage hugging each other. People don't do that at medical conferences. I was thinking of Deepu and the luminaries thing. I was like, yeah, we do. It was just neat to hear that perspective. And I think we got him drinking the Kool-Aid because he's, I'm totally coming to St. Louis. I'm going to be on the planning committee. We're like, all right.
Yeah, I think that resonates so much. I did a couple of presentations, but two of them in particular were first time CFHA presentees, and one was a medical provider. And in preparation, it was very much, okay, like, oh, do I have to do this? Do I have to do this? Are we going to wear this? Do we have to do this? And I was like, no, this is not that group. This is not that. Like, it's completely fine. I kept going, believe me, trust me. And it wasn't until like she came, we did the presentation, she got to experience some things. I said, so what do you think? She was like, oh, it's real laid back. And I was like, it is real laid back with lots of great information. Still still professional information, connecting with people professionally, but laid back. Take out what's the word? Pomps and circumstance. What's
Yeah.
the
Well,
English?
and I think that it strikes me like as you're saying that it's not that we're not serious about the work that we're doing, because the quality of presentations, the quality of evidence and connection, and the passion for what we're doing is there, but in a way that I feel like brings in who we are as people too, that I really appreciate.
I was saying when Bridget, David, and I were preparing for a presentation, we were just like laughing through the whole thing. And I think we said something like, you can't be like this joyful and look like we're serious, right? You can't really pull that off and not look really giggly and dumb about it. But at the same time, the things that we're saying is really passionate and life-changing, really. I was in one of the presentations with Sandy and Perinda. They were going over the playbook. But in that room, I just saw folks just walking around and people there that have decisively influenced things that I do every day, right? Like I can point to people and say, here's where I picked up this idea from that is happening live in the clinic. So I think Safe HIT Conference is always a list of things that you take home back with you with a certain sense of excitement and joy to implement back home, right? So I feel like this is where you go to retool clinically, theoretically, and all the ways that it's going to help your professional life. But I feel like this is also where many people, even if they're a first-time attendee, recharge or find that this is a great place to recharge.
Yeah. So what did you guys present about? I know that we have some really prolific writers and teachers here on our panel. What'd you talk about?
This is low-hanging fruit here because you have Deepu and I on here, and Dave joined us, and we did apparently it's just an ELO, but I call them ELOs because I don't know.
Elos.
It seems like it should be ELO for ELO. So we did an ELO on the clinician stance and had an absolute blast. And we were happy. We were disappointed, but also happy that people showed up. If DP wants to explain that one.
Oh my gosh, we were prepping for it and we were just talking and just laughing all the way through. And then we were like, if people show up, that'll be great. But if people don't show up, we'll still have fun for 3 hours.
Yeah, we were just excited to have
I
3 hours
that.
together to like mind meld and come up with
Yeah.
stuff. But it was really cool because it was the first time that we had done this specific material. It's stuff that we've been talking about for years. And it all started with last year, CFHA 2024, and a presentation that Deepu and Sandy Brownhead did. And then we were like following up and texting. And then from there came this idea of we really want to operationalize the clinician stance. So we made it into from an acronym of SEEING, SEEING, about having shared vulnerability, embodied empathy, and inquiry, noticing exceptions like in solution focused brief therapy, and being a guide. So basically, we took what's already there in the literature, pieced it together, and we've now added that to contextual interviewing, Access V, and other ways of approaching that. Basically, if you don't have the clinician stance, then the rest of your work is going to fall flat. And so it was just it was a great presentation. It got me, Deepu, and Dave too excited about what we're going to do next with
Very
it. Decided yet, but
Yeah.
we're going to do something with it for sure.
I
Well,
love a
write
good
it up so I can
acronym
teach
to
it.
remember stuff, right? Be a good acronym.
Need it.
Seeing.
Helps with the recall.
Your task is to see your patients as they are.
Yeah,
Yes.
yeah. And I think Deepu and Bridget, the silliness, the laughing through it, that doesn't to any degree make me think any less of the professionals. If anything, it's refreshing. It's like joy
Right.
can be part of being a medical
Right.
person. What?
Yeah.
We can have joy. It's radical and amazing. And so many people need that nudge or that have fun in your work. I don't know. I was missing that for a long time. And I thank all y'all for, hey, that's part of it too. It's amazing. It's so good. And just Bridget, like meeting, I can't tell how many people are like, wow, it's Bridget and Dave, the Bridget and Dave. Like it's neat to come to the conference and meet some of your mentors and heroes and have them be so approachable. Again, that's what feels so different. It's not a who are you and what did you publish? It was like, tell me about your shop. What are you doing there? How can I learn from you? And come on next year and present. And come on the next year and join the board. That element of shared community, it's unheard of. And it's just so magical.
Yeah, our interns were teasing Dave and I so bad. They're like, "Oh, I didn't know that I should probably get your autograph and maybe get your autograph outside of something than our chart notes and stuff." They're like, "Did you like?" Yeah, they were teasing us so bad. They're like,
Well,
"I'm not letting go."
you don't realize it, right? If it's
Yeah.
their kind of first time
Yeah.
coming,
Yeah.
like I remember my first year, we were having some conversation in the chat, just so y'all know, we could talking to each other in the chat. We were having some conversation in the chat of like, when did we first get introduced to CFHA? And I was saying I was late to the game. It was 2016. And that was during a time where actually Naphtali and I were both working at Center of Excellence for Integrated Care. And I remember like having like seeing him like, hey, like talking like you normally do with a colleague in the hall. And I was like, hey, like I'm going to this session. Where are you going? And we were having a conversation and someone was like, a group of people standing by talking. And I was just like, what's going on? And they're like, that's Naphtali. And I was like, what what is happening right now? Like what is really happening? And they're like, you have the thing on the internet. And I hadn't realized that he had these string of videos at the time that people were watching about integrated care and primary care behavioral health and all that. And they were just like, can we take a picture with you? And I was like, ooh, let me get out the way so y'all can take a picture with Naphtali.
Monica, you're
So
like, "I'll
it's
take it. I'll
like,
take it.
yeah,
I'll take
let
these
me
photos
take
for
the
you."
picture. But yeah, so that very exact, listening to that, Bridget, reminded me of that very exact moment when I was like, oh, you're big stuff. Oh, got it. Let me move.
Got the
At first,
memo right now.
at first I was embarrassed, but then like later I was like, you know what?
You big
Yeah, so
stuff.
if we say something, you listen to it. No,
Lean into it. Lean
Yeah,
into it,
lean
girl.
into know what I'm saying. It's like the
no.
parents, right?
Yeah.
We've been here. Listen to what
Mhm.
I'm saying. We know what's
And
going on.
our interns this year are so like receptive and open to feedback. So like I wanted to talk all this shit and all this stuff, but they're like actually already great. So I was
Yeah,
like, all right, we'll
yeah.
have to wait for another year. Like maybe we get a year where they don't really want to listen to us. Be like, all right, everybody
Listen,
pay attention.
do you see
Yeah.
these plaques? That's
Yeah.
We've been at this since you were born, before you were born. No, I'm kidding.
yeah.
So, what else? Monica, you were talking about presenting. What did you share?
Mm. Yeah, so I presented one presentation again for both of them were new time presenters at CFHA. One, this is their second time coming to CFHA, and last year I was like, you can present. Like you got data. Come on. You can present. Show me. And I think that there are a lot of people, if you're listening, there's sometimes you're nervous because you're like, what do I have to like all of these people who've been doing it for years? you have stuff to share, your organization and your clinic and what you're doing better than anybody else. And so I was like, come on, you can do this. I'll do it with you. What do you want to talk about? What's the data you have? Let's talk about it. So we actually did a presentation on engaging your entire team. So not just patient engagement, which that's what most people think about, engaging the patient, but we came from the perspective of, yes, that's important. And it's important to engage your entire healthcare clinic and healthcare team and what you're doing around integrated care and infusing that spirit of integrated care through everyone. And so we also got to share some data on the different things that had done, what the results of that had been, the impact on patient outcomes. So we were able to pull all that in. So that was really good. And then the other one I did was around health equity, two clinics, very different, one pediatrics and one that's oncology. And so bringing in some specialty medical, brought in medical provider from Peds, and that was their first time at CFHA and both of their first times presenting here.
Woo,
First
woo.
year, I was like, come on, let's go.
Yeah.
And so we shared some of our health equity data that we have come up with. We were implementing collaborative care, but also just trying to take this health equity lens and looking at some things and just some conversation around the importance of collecting data, demographic data, but also how do you make that comfortable for your patient population? What does that look like? The different access or entry points in which you could do that. And so some good stuff that came out of that too. Yeah, it was good.
Monica, I'm so glad that you said about like encouraging people to just look around and see what you're doing,
Mhm.
because so many of the presentations can be absolutely where somebody can come and take some nugget from you, even if you're not an expert or even if you haven't been in the field for a while. Just look around and see what it is that you're doing. And we did a presentation where basically Dave and I moderated, where we had a physician and a MA, or former MA, she's now our BHC manager, but former MA, talk about do's and don'ts regarding integration from the lens of a medical provider. So they basically sat up there and
Ooh.
told their truth about,
Ooh.
hey, like, you want to get buy-in on the medical team, do this, don't do this, don't do that.
Yeah.
And they just broke it down, and it was, people like loved it. We did another
Mm.
one on a panel with Meredith Williamson and Stacey Obide and one of her physicians, where we just talked about the scar. We ran back the scars of leadership. So literally we just sat up there and
Mm.
talked
Mm.
about the hard things about being in leadership. And
Mm.
then, so yeah, you just look at what you're doing
Yeah.
and somebody can benefit from that.
Yeah.
And they can take a
Absolutely.
nugget.
Yeah.
Yep. And that's
100%.
what it's about. We're not asking you to make everyone else in the room with you
Yeah.
experts. What is
Yeah.
it that you have learned, your experience, and someone else could take away from that?
Yeah.
I facilitated a panel for women in leadership, which has been a committee at CFHA. For those of you listening who didn't know, there's been a committee, and then they decided to do a presentation, and it was four women, very different backgrounds, and then I just facilitated dialogue and conversation. Let's just talk
Mm.
about this, right?
Yeah.
What are the barriers that get in the way? How are you managing to get beyond that? How are you reaching back and being a mentor and providing opportunities as a gatekeeper in your position for
Yeah.
others behind you? It was just good just to have frank, open dialogue about what their experiences were, what they had
Mm-hmm.
been doing, what worked for them, what hadn't worked for them. And so it goes along with what you're talking about, Bridget, that like we all are doing this work. We all have something to bring to the table and share. I
Yeah.
think that we get very nervous when we start looking at the call
Yes.
for papers. We start looking at that and we see all the requirements,
Sure.
and sometimes we get worried about the data part, and it's not. I wanted individuals to see it's not as intimidating as you think it is, and you probably
Correct.
have the data. You probably just
Yeah.
haven't really been looking at it. So let's talk about what you're doing and how to
Yeah.
look at it. We have a committee that can help you
Mm-hmm.
with that if you want it. We
Yep.
have a research and
Yep.
evaluation committee, a REC committee,
Mm-hmm.
that if you're like, hey, I want to do this, I'm just not sure, contact someone on the REC committee who would help you so that you're
Mm-hmm.
not doing it alone.
I love that.
Yeah.
I'm curious, did you guys feel any more presence of, and Bridget sounds like you did, the medical folks? That's what Laura and I, as the medical directors, our whole charge has been is bring some friends. We need more PCPs showing up. We need more EAs, NPs. Did you feel like we're starting to see more of them? I hope so. We developed a medical professional track. Wasn't anything special. It was just a list of, hey, if you're medical, maybe this session speaks to you. Maybe this is something you could take home to your shop. Did you feel any energy around on those medical colleagues? Sounds like you certainly did, Bridget, with having Brooke join. Yeah, I'm curious your thoughts. Did you see us showing up, the medical folk? maybe?
Yeah, I think because one of our physicians from our shop went and she's super involved in everything. So of course did you ever get to meet Dr. Stedman?
I saw her in your session and I was like, oh,
Oh,
I've heard her PCBH corner and like re-listened to it prior to a meeting. I was like, oh, I need to get her talking points down.
yeah.
But yes, wonderful human.
Yeah, it was cool.
Yeah.
I think that there's definitely more talk of medical side than there has ever been. So I think that it's gonna
Yeah.
take a hot second, but I feel like on the forefront of people's minds, and it's
Yeah.
definitely in my mind. And I think
Yeah.
that we have so much to learn from medical, and that medical has so much to teach us about how we can do implementation.
Sure. And there's some levers there. Like we had representation from the AMA, the American Medical Association. Chris Botts and Sam Lowen Smith came for, I don't know, the second, third year in a row and presented. That's a big
Yeah.
lever to pull to have them in that platform say AMA cares about behavioral health integration is remarkable. They even are going as far as saying, yes, primary care, but they're pulling in their collaborative. So that's professional associations from oncology, from GI, from cardio. They're like, we need integration in specialty care too. That is so inspiring to hear a group like that talking about this work and how do you apply it in your setting. So I'm really thrilled to see where that goes.
No, I was excited to see a lot of the positions there too, because when I was part of the board and started my presidency, one of our goals was to increase physician membership. And it was around the same time the medical directors turned on as well as part of CFHA staff. And I cannot do what I do on a daily basis without a medical provider next to me, because if they're not in clinic,
Mm-hmm.
I'm not in clinic, right? Like it doesn't make sense for me to be in a clinic by myself. So our learning should be together, and how we craft our professional identity should be also side by side. And so I was just excited to see the more number of folks there.
It's so good. For every one of the great PCP or medical folks you guys, your lives, your careers have touched, I think about this huge beneath the glacier, right? You have some docs, some providers that have had the benefit of working with you all in integrated care. And then there's a huge population who've never had that experience, who don't even know what they don't know. That's possible. And it's what makes me think of like, how do we get in front of those audiences? Like, I feel like you guys need a road show and you need to go crash the party at the stuffy buttoned up. I shouldn't say that. I'm not, no shade to the cardio, but go to the cardio meeting and be like, hey guys, this is integrated care. If you're a cardiologist, this is what I could do for you and your patients. Or go to the oncology meeting and be like, yeah, dealing with cancer is devastating. And whole person care means thinking about the brain and the health of that person, not just on the oncology side. So I would love to see just like a little transplant join, crash the party at a big fancy medical conference. So this is integrated care and you're going to love it.
Right. And we'll
I
show
don't
you
know.
how to talk about evidence with your buttons down.
All right,
Yes,
with your
right.
buttons
Put your buttons
down.
down.
Definitely, I know that's a strategy to crash like for us having worked in integrated care and this whole person care, whole team-based care approach. To us, it doesn't feel like crashing a party when anybody else
Right.
comes. We're like,
Yeah.
welcome, cousin,
Welcome.
welcome to the
Yes.
cookout. We're fine. But that is something to be said, Jen, about if you are in some type of specialty medical or there are other conferences you go to, thinking about presenting at those conferences on integrated care and mentioning Collaborative Family Healthcare Association. Crash a party with you any day,
Oh,
Jen.
girl, you know it. Absolutely. I crashed the AMP, the Association of Medicine and Psychiatry meeting last fall in Milwaukee. It was like CFHA psychiatrists. And they were like, oh, interesting. And I think we need champions too, though, because I was thinking
Yeah.
about the PEDS Association, American Academy of Pediatrics. Ewan Boylston is a fantastic, she presented at the conference, pediatrician that's wonderful integrated care leader in North Carolina. And we were talking about maybe doing an APA thing and noticed you have to be an APA member to present. So it's like we need those champions. We need those toeholds of the Dr. Boylston that is a pediatrician to bring some of us to the party and go to her conference, or a cardiology champion to, if that's the gatekeeping step, to go to the cardiology meeting to say, hey, I want to bring Bridget and Deepu and Monica for a session and talk about what that could look like in a cardiology office. So just, I don't know, shout out to all the interdisciplinary friendships and alliances with us. And that's what CFHA is about, right?
I was about to
Breaking
say,
down the silo.
luckily, this type of collaboration works best in relationship, and relationships are the things that we do best. So I know I'm a big conference nerd, but so are we all, right? And I think if you've made it far into this podcast, you are too. But this is what moves us forward. This is what connects and takes our conversation. And just like you guys were talking about, Bridget, like you went to Deepu's presentation and then you were texting and this next idea came out. And that wasn't just because it was Deepu and Bridget and Dave. Now there was that existing friendship, but also we are like reaching out and pulling forward. And that's, I think, what this group does well. I am curious to hear what is something that you guys are going to take with you. So if there's that piece of I'm sharing what I've done, but I'm also looking forward because we never seem to rest. What did you hear that sparked something in you?
I'll tell you.
Oh,
Oh,
go
go
ahead,
ahead.
Monica.
I
No,
was
no,
just
you go.
gonna say, I went to this session. I need to download the PowerPoint. I went to this session and I do not remember the gentleman's name, so please do not be mad at me because I don't remember your name. However, so he was talking about sleep. And although we all know the importance of that mind body connection, right, and all of that, but he was bringing research around naps and the best actual time frame in which to take a nap. And because if y'all didn't know, like you need to take your naps, you need to take a nap. And I do mean nap like 10, 15 minutes. And it needs to be at like 2. He has some research around if you take your nap at 11, like you're actually causing yourself to possibly have other health conditions. Like it was just interesting to me, all the data he had on nap taking and the best to take your nap. Now, it was really all around sleep and helping individuals that had insomnia, right? And he talked about CBTI and some of those things that I think many of us, or hopefully many of us, do know about. But to see the data he had on that, on individuals with sleep apnea, and like it's best for you to sleep on your side, and all of the data and research from health outcomes that came from that. If you're going to drink your coffee and then take your nap right after, because then by the time your coffee actually kicks in, you've just woke up and actually helps you last longer. Just all of these little nuances that I was like, oh, I hadn't thought about that. Oh, okay, that makes sense. The research says what? So I was taken aback by some of the stuff that he was talking about for my own individual self, but then also thinking about how that could help lots of patients as well. So I loved that session.
With evidence.
With that.
With
Naps
evidence.
with evidence.
Yes.
That's right.
Oh,
I was thinking a lot about one of the plenary sessions and a couple of other sessions, but Jody Palaha and her colleague did an amazing conversation just about taking what we do beyond the walls of clinic. And they talked a lot about advocacy and working at the county level. Shout out to both of them. Jody is an elected official for our county. And so she talked about that. That was just
yeah.
frameworks to think about of how we make impact beyond the borders of our clinic
Yeah.
and our professional lives. So yeah, that's something I take back away with me. The other exciting thing was my team just getting really pumped after everything and saying, we got to put a lot more proposals in next year. They delivered a talk. I didn't go to the talk, partly purposely because I want them to have their process of professional development. And in the audience are like Perinda Khatri and Patty Robinson and like all the people that probably made half of the content on the slides possible. And what an honor it was for them to receive their accolades and all of that because they did such a good job and they came and told me. So it's a way of professionally forming yourself along the way as you do these things.
Yeah.
I
I
completely
share.
forgot one thing
Yeah.
about people receiving their accolades that also is a highlight for me every year. And I think some people leave before they get to it. And that is the awards luncheon
Yeah.
on
Mm-hmm.
Saturday.
Mm-hmm.
And I know usually by Saturday, some people are like really tapped out. You're ready to get home, like all of the things. But if you are not staying for the awards luncheon, first off, the food was great.
Yeah.
Your plated lunch was great,
Yeah.
but it's an opportunity to really highlight some people. We're all doing amazing things, but to highlight some people doing some really amazing things, and the importance of putting in when CFHA sends out, hey, it's nomination application time, like nomination. Who do you nominate for these different awards? Think about your colleagues around you. I know our heads are down. We're doing work. We're training people and doing implementation, like doing all of the things. But who are the people around you that you're like, oh, they embody this? They do not have to be these individuals that have been in the field for 40 years. We're not
Right.
talking about that, but there are people who are working around you, have been working around you in integrated care, know what they're doing, and embody some of these different awards. I'd love to see more nominations put forward and people stay to give people their flowers, as they say, give people the flowers while they are here and can receive them.
I love it. Yes. Echo you, Deepu on Jody Plaha and Angela Hageman. This is true. Like you can literally, and I did reach out to Angela. My community has an opioid settlement fund. Our county's looking what to do with it. And darned if she didn't email back, yeah, let's talk. Let's get on a Zoom. That's so profound that I don't have those answers, but I know somebody who does. And thanks to CFHA, you can connect with people that have that lived experience and the career path of this is what we did in our local community. And here's how you could do it too. And it's just great. That and my other shout out is always Bridget and Dave. Contextual interview. I'm still like practicing it as a PCP and getting better at it, but it's always a good refresher to keep that mindset in those patient encounters of what's their context, how does that behavior make sense. So good.
All right.
Thanks. Yeah. Are we wrapping up or no? Or we got
I don't
more?
know. We
Because I
keep
got more.
going because Grace left, so we're here.
Yeah. Now we're left to our own devices. We're gonna do like a 3-hour.
I know it's left. Let's
Let's get crazy.
I'm always looking at Dave and I before the conference, we always think about who do we want to connect with? And we also think about listening for themes of stones in the shoes. Because as a trainer, and that's how I see myself in a lot of ways as a consultant, a trainer, like what are people running into? And we ran into a lot about productivity, metrics, reasonable expectations of seeing patients. And it's really it's a very interesting thing that people are feeling like seeing 8 patients a day is too much. And I struggle with that because we're doing integrated care. I don't know. Anyways, I'm gonna get myself canceled on here again. But so I'm trying to
cancel,
think.
like cancel culture. Not canceled, Bridget.
I don't know, man. Say some unpopular things, right? But at the same time, it's like you got to figure out how to talk about it, how to train on it, because the words productivity sometimes make people literally have a panic attack. And I'm assuming there's a whole context for why that was the case. And we don't want to just perpetuate something unnecessarily. And at the same time, there are basic expectations. If you want access and you want reach and you want to be uptaken by the medical team, and if you want to be a regular member of the team, you can't look so different and play by a completely different set of rules. So anyways, that's been on our mind. So Dave and I have already shot and already uploaded a PCBH Corner number 109 talking about what new BHCs in our opinion should know about. And so we start on that topic. But yeah, I want to learn how to talk about it in a way that doesn't immediately turn people off.
Yes. And that's so common with productivity metrics. People get told that you're not doing enough, you're not working hard enough. I've been in that shoe. That feels really shitty. But I love the pebble in the shoe approach because I don't think anyone's opposed to like working harder and showing up for our patients. I think you're spot on with the pebble in the shoe and the training piece. We probably need efficiency. The reason why I would push back against just see more patients, Dr. Thomas, was like, I needed tools, I needed efficiency, I needed more team-based care. So that was possible while honoring work-life balance, because otherwise it was just, I'll just stay an extra hour, 2 hours after a close of clinic to chart and miss the soccer game on Sunday. And that didn't feel right from a values perspective. So I think the training and the pebble in the shoe of like, how do you get there? What is the efficiency
That
that you need
part.
to do is so spot on, Bridget.
Yeah, our team has actually had this conversation already thinking about something for CFHA for next year based on some common things we saw of people sometimes in the audience kind of freaking out almost when they would hear a concept of this is how you do documentation or this is how you do warm hand or whatever. They would be freaking out and they'd be like, oh, we don't do it like that. Oh, that's what we're supposed to be doing. And as we started to dissect some common themes, what we realize is sometimes when you come to the trainings, depending on who you're going to see, yes, they're going to show you what is more down the road. You have to work your way there. Here's some
Yes.
things you need to know how, like ground running. here's some
Yes.
few things for you to know now. And then here's where you should be a year from now. Then
Yes.
here's where you should be breaking it off into these smaller pieces to get them to down the road where they see. And so we noticed that and actually have been having some conversation and dialogue about what that looks like to show progress over time for you professionally
Right.
as an individual in the same way we would break things off for a patient. We're not going to say, okay, what? You want to stop smoking tomorrow? Just throw them cigarettes away and have at it. We're going to have a plan. It's going to be a process. It's going to be something over time. So same kind of thing that we saw.
I think any concept for its own sake is never healthy. Like productivity for what, in what context, in what
Mhm.
resources. And to your point of like incrementally building things up, I always think about like when we were implementing PCBH, we had kind of national standards, the levels of integration and the ideal behaviors. And our goal is always to measure up and realizing that we're not going to get there tomorrow. But at the same time, as we did that more and more, we developed a sense of like native intelligence about how this works, which is then what gets translated into conversations and presentations, or what Dave, Bridget, and I worked on. It was just like trying out different things in the patient room that kind of struck a different chord, and then being able to elevate that to a conversation, right? So I'm a big fan of building prototypes until you get to the perfect good, right? You're never going to get there. That's the hot take for the morning. You're never going to get
We're gonna
there.
get there. Don't even
Right.
try.
Yeah, there's no point to any of this. No, I'm kidding.
But thank you for showing us prototype number
Yeah.
2062.
That's right. Yeah. And yeah, so I think that's what's exciting about what we do.
Yeah.
Now, do we land the plane at this
I
point?
think, yeah.
I
Is
think
that
we
what's
I
land the
think
plane.
okay.
it's like a natural
People,
break.
we have hopefully excited individuals, and they're going to show up in St. Louis next year for CFHA. Yeah.
All right. I have an ending. I had a different ending, but we're talking so much about joy. We're talking so much about like giving that a shot in a professional setting. I have a little poem called Don't Hesitate by Mary Oliver. So we'll end with that. If you suddenly and unexpectedly feel joy, don't hesitate. Give into it. There are plenty of lives and whole towns destroyed or about to be. We are not wise and not very often kind, and much can never be redeemed. Still, life has some possibility left. Perhaps this is its way of fighting back, that sometimes something happens better than all the riches or power in the world. It could be anything, but very likely you notice it in the instant when love begins. Anyway, that's often the case. Anyway, whatever it is, don't be afraid if it's plenty. Joy is not made to be a crumb. And that's the end of our podcast. Thank you guys for joining us.